Since I was a kid, I've always wanted to have a career in the medical field. At first, it was a doctor, and now it's an orthopedic surgeon. I thought this year the perfect topic would be hospitals. I thoroughly researched hospitals and how each department works together to diagnose a patient. Imagine getting in a serious car accident and transported to a hospital, only to find that they don't have enough resources and they have to transport you. I would be seriously mad. Some hospitals, due to their finance, are smaller and don't have the materials to treat a severe patient. Because of their variety of resources, hospitals have classifications. A Level 1 hospital can treat almost every injury, from prevention to rehab. They have 24/7 house coverage by general surgeons. They also help the surrounding community by providing information and resources to surrounding smaller hospitals. A Level 1 hospital is able to treat nearly every patient. However, a Level 2 hospital is sometimes not able to treat all the way from injury to rehab. A Level 2 hospital also has 24/7 immediate coverage of similar departments. They also provide education programs for staff. Highly advanced procedures are often referred to a Level 1 hospital. Compared to the higher level hospitals, Level 3 hospitals can provide surgery and intensive care. Because of their limited resources, they develop transfer agreements to move patients to more advanced hospitals. Level 3 hospitals seem to have a limited staff, but they actually have 24/7 immediate coverage by emergency physicians and surgeons. A Level 4 hospital can provide ATLS, also known as triage and stabilization of injured patients. They have trauma nurses and physicians available upon patient arrival. They sometimes provide surgery, but most of the advanced treatments are transferred to bigger hospitals. A Level 5 hospital can only provide initial evaluation and stabilization of patients. Most often, they prepare patients to transfer to a higher-leveled hospital. As I've researched more and more about hospitals, I came to realize that they're just like a business. Just like any other business, hospitals also have levels of hierarchy. A hospital has these levels of authority in order to give the proper responsibility to each job to take care of a patient and the hospital as a whole. The top of the chart starts with the Dean of Hospital. This position has the highest authority and makes any financial or administrative decision, but when making decisions, they must convene with the Board of Directors. They will always try to make the decision based off of whether it benefits the hospital as a whole. Next on the list are hospital admins. They supervise and administer the hospital staff. They're kind of like being a manager in a grocery store. Underneath them are the specialist surgeons. They're considered top-level physicians, almost like masters of their field because of their many years of experience. They are kind of like a bakery manager in a grocery store. Under them are normal surgeons. These surgeons are present in any hospital. The next level consists of silent doctors. They're called silent doctors because, well, the patient never sees them. These include radiologists, pathologists, and anesthesiologists. After this level comes nursing. Even though some nurses have more experience than surgeons, because of their level of education and qualification, they are lower on the pyramid. They're kind of like a grocery clerk in a grocery store. Finally, at the bottom of the barrel are medical students and interns. Towards the end of med school, students normally go and intern at hospitals before starting their residency. They're placed at the bottom of the pyramid because they have no experience and sometimes no degrees at all. Although doctors in a hospital go through the same curriculum in medical school, after med school they go into their residency and work in a department that specializes in a field of medicine. Hospitals are essentially multiple departments working together as a cohesive unit to diagnose a patient. Multiple jobs team up in order to treat a patient, all the way from stabilization to rehab. When a patient first enters the hospital through the emergency room, the emergency department, also known as the ED, step up and help. The ED helps people that come into the emergency room and classifies them as trauma. They also triage patients, meaning they assess the patients in order of need. By triaging patients, they make the process flow more smoothly. The next step is determined by where the patient's illness is located. Each specialty treats a specific area of the human anatomy. Once the doctor from that specialty confronts the patient, they will order a scan to help locate the problem. People like an MRI technician or a radiologist coming from the diagnostic imaging and radiology department, will take the patient to take a scan, like an X-ray, CT, or an MRI. Along with diagnostic imaging, blood tests are often done to a patient throughout their stay to give an update on their body. The hematology department most often runs these tests in order to inform physicians about their patients. After giving a diagnosis on a patient, the respective specialty will decide a course of treatment. If surgery is an option, then the anesthesiologist will administer sedation for patients to go into surgery. Once the patient is treated for their illness with a procedure, they are then placed in outpatient services. Outpatient care is any service that doesn't require the patient to stay overnight at a hospital. To relate to this project, I made a Microsoft Forms that is a simulation of you as a patient being treated. Click on the link below in the description to take the quiz. Through this scenario project, I've learned a lot of new information about the medical field that will help me in my future career, and I hope whoever's watching this learns something new too about hospitals.